Hello and welcome to Pisgah Health Today. My name is Angela Owen, and it is my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals who are committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Mark Burrows. Mark formerly served as Transylvania County Planning and Community Development Director for 25 years. What a legacy he had there. And now he comes to us today as the Senior Community Program Manager for Blue Zones Project Brevard. So in a nutshell, that means Mark takes care of all things policy. Welcome to our program today, Mark.
Yeah, good morning. How are you?
I am doing well, thank you. And yourself?
I am good. We are house sitting one of Betsy's colleagues' huge German Shepherd, and Gypsy and I walked in this morning, and so if you hear snoring in the background, that will be about a 75-pound German Shepherd is laying down here on the ground behind me. So, yeah.
Well, my small dogs, who are about 6 pounds each, might do some competition there. So this is part of the fun and joy behind this world in which we live. So we welcome your German Shepherd dog to the program if he chooses to show up in here today. Well, Mark, yeah. I love that you are part of Blue Zones Project Brevard and leading policy. What in your background and your history led into this place where you're now leading the policy work for Blue Zones Project Brevard?
Well, I mean, as you noted in the intro, planning, economic, community development background, nearly 30 years of work with Transylvania County, 25 of that in economic development, policy work. I started off as the county's first planning director in 1990. And so engagement at the community level on many different things, but mostly policy work, and had the great pleasure of working with a lot of really interesting, dedicated, and I think sincere individuals that both elected and appointed that wanted to help improve, not only help, but to make Transylvania County a better place. And I was very flattered when actually Lex Green approached me last fall, late summer, early fall, saying Blue Zones is going to be coming here. And I knew that because I'd been attending some of the events and was aware of that, but really hadn't thought about anything in terms of another job. I was content being retired. But Lex said, you should look at this and look at the policy piece of it. And I did. I went to ShareCare, and ShareCare is actually the organization that is employing Tammy Hopkins, Trent Humphreys, and me. So ShareCare brings Blue Zone Project to Brevard, and our sponsor is Pisgah Health Foundation. At any rate, I went to ShareCare's website, and I was able to see jobs around the world. And I saw 2, and I know it's going to seem a little bit of a divergence, but the 2 jobs were in Berlin, Germany, and I went, that's where I want to go. And they were for developing apps for the iPhone and Android. And so ShareCare is a digital health company. And part of what they're trying to do is bring about technology to help people be healthier. But they also have, as part of their business platform, is looking at Blue Zones. And Blue Zones looks at policy. It looks at, and I'll talk about policy a little bit more, it looks at engagement of individuals and small groups, and it looks at organizations, and it is trying to focus on ways to help people and a community be healthier through making healthy choices easier. And so on the policy side, my work focuses on the built environment, primarily for the city of Brevard, food and nutrition, and then smoking and vaping and trying to reduce that. Trent Humphreys is the organization lead, and he's working with schools, work sites, restaurants, grocery stores, churches trying to help improve the lives of those individuals through those avenues. And then I think you mentioned you interviewed Tammy Hopkins yesterday. She is our people person, engagement lead, and she's the one that is working with individuals in small groups to provide MOIs or something that is easier for me to understand is more than I when you get a group of people together for a walking MOI or a potluck or cooking, something of that nature, where you bring people together, and also of helping to establish purpose workshops and trying to help us with, as you mentioned earlier, Power 9. And one of those principles is looking at purpose. And we know through evidence that if you have purpose, that provide, if there's meaning and purpose, it makes you engaged, healthier, and more alive in that community and helping other people. So those are the different areas that we're working on. My background, I think, was looked at from the standpoint of knowing a number of people, both within the city and the county and the region, development of policy and supporting that, things to try to do right and things to avoid. So that's where I came in. And then during the process of interviewing and negotiating, they asked if I would also consider being the lead person for the Blue Zones Project Brevard team. And so that's how I came about. If you want to more specific, you would have to ask the people that were interviewing me, but I feel very fortunate that I was asked to apply and was able to take the position.
Well, we are fortunate to have the experience that you bring to the table
Thank you.
and the passion that you bring for our community. So I'm really grateful, as I know others are also, Mark, to have you leading the program and to be playing such an important role with policy. Back us up just a little bit and tell us a little of the history. How did Brevard come to be the 50th community here in the world? That's my understanding, right? The 50th community in the world for this Blue Zones project?
Yeah, Brevard is the 50th Blue Zone project. There are now 51. And in fact, there are other communities that are being evaluated and thinking about becoming Blue Zone projects as well. My understanding of the history is that you have to go back a couple of years ago, and Lex Green and his family were just at a dinner table conversation and talking about different ways of helping a community. And one of his sons actually identified Blue Zones, and Lex, curious as he is always, did some background research and looked at it and said, this does fit really the social determinants of health that Pisgah Health Foundation is looking at, and ways of how do you improve the health of the community. And all of this was pre-COVID, and so we got to kind of keep that in mind. But looking at policy, looking at engagement, and looking at work sites, faith-based areas, schools, if we could figure out how to improve the health of individuals in these locations, make policy that makes it easier to walk safely and encourages, in fact, walking and biking in downtown Brevard while improving the ability for motorists as well, that's how you actually build a community. And so it's my understanding then that Lex reached out to Blue Zones and started initiating some conversations with Blue Zones. And in that process, last summer, the summer of 2019, Blue Zones brought a team to Brevard, met with Lex, met with his board, and then other community leaders. And they began evaluating whether or not they thought Brevard was actually suitable. Just because a community wants to be a Blue Zone community doesn't mean that they necessarily will be. The core group comes in, policy experts come in, and they evaluate and see whether or not that community is in a position, and position meaning that it has resources, that it has policy in place, and that people in general are really interested in focusing on the well-being of that community and the individuals there. And I think that what I heard, not being part of that process, Angela, was that Blue Zones was very impressed with the dynamic of Brevard, its leadership, with Pisgah Health Foundation, its leadership, and the overall what they thought receptiveness of Brevard was to having a healthy lifestyle and really promoting the Blue Zones principles. So that is how it came about. There was a little bit of an effort. I think it was important that Brevard be the 50th, and therein there was another community that was right at that point, and so I think that the Pisgah Health Foundation really wanted to be able to identify as the 50th Blue Zone community in North America. And so the contract was signed with Pisgah Health Foundation as the sponsor in August, and then Tammy, Trent, and I were brought in late October and began our work as we did what we would call a deep dive into the community that ultimately led to the adoption of a blueprint, the Blue Zone Project Brevard blueprint or work plan that started this month, May, and it is a 3-year plan that renews every year. So we have a work plan now through April of 2021. There's a steering committee that Lex and I put together with community leaders that will help us evaluate the work that we have done. This is a very much a metric-driven process. It's not like, well, we just have Blue Zones here and it feels good. We actually are metric-driven, and we have to meet performance standards as defined by the blueprint that we have now, or the work plan. Does that help? A little bit of the background there. I really think that you have to look, the genesis is probably Lex and his son, and then just a real appetite to look and see what they could do, they being Pisgah Health Foundation, could do to enhance the well-being of Brevard, the surrounding area, and ultimately the citizens that live here.
I love the power of a simple dinner conversation leading to such a great effort here for our community at large. Super exciting as you think about that. And you mentioned,
having 2 kids and eating most meals at home together when they were in school, you really do have a powerful situation where you can you learn from the kids, and then as I mentioned before, you have somebody like Lex that's very creative and engaged, constantly trying to figure out what else can we do, exploring something then that ultimately brings in the city of Brevard. Brevard was a huge champion of this. You had city council members, you had the city manager, all supporting this effort. Many of them were aware of and had heard about this before, but it really, the genesis goes back to Lex and his board pulling all this together.
well, Mark, you referenced the city of Brevard, and I understand that they recently put forward a build grant request to the U.S. Department of Transportation. Tell me more about that, and what role is Blue Zones Project Brevard playing in that?
Well, it's a huge opportunity for the city of Brevard, and the role of Blue Zones, I do not want to overstate our role on that. We are support, and our support was trying to provide letters of support from our national experts on the built environment, helping craft letters from other individuals and community groups, showing that there is a need for this. But to the first question, what is the build grant? Is a U.S. Department of Transportation grant that focuses on essentially rebuilding a community, and in this case, slightly over $15 million grant request based on a lot of work that is already underway, but can either be expedited or supplemented with other work that the city is already working roads. And so the major focus of the Build Grant is looking at rebuilding downtown Brevard, East and West Main Streets, and then Broad Street from Morgan all the way to North Caldwell Street. Improved sidewalks, bike lanes, bump outs so that when a pedestrian is trying to cross the street, they have a safer place that is more visible to automobiles. They can be seen. Making sure that the existing signalization that there is in place is working correctly. Sidewalks, I think I mentioned, and just trying to enhance that entire downtown experience, making it safer, bikes, pedestrians, and automobiles. Another is looking at an existing DOT, North Carolina Department of Transportation project from essentially North Caldwell Street all the way to Pisgah Forest, and trying to make sure that that is enhanced for biking, walking, and automobiles as that is improved. But probably one of the biggest pieces on that is looking at creating an underpass or a tunnel under what would be North Broad Street, right around Allison Road, near the entrance to the Catholic Church, Food Matters, so that right now you have a cross light at Osborne and people have to stop there and they have to cross over. If you could just go a little bit further, and as they rebuild that section of road, they can put in a tunnel that will be a culvert covered back over, so it's not truly a tunnel, but a passageway then that would allow people to cross under US 64-276, making it much more safer. And then I think the other piece that I find really exciting about the Build Grant that the city has moved forward with is then connecting Depot Park, which is really the terminus point right now, or near the terminus point of the walk bike trail that the city has been working on for almost a dozen years. And it would extend then along the outskirts or just at the edge of Rosenwall community, and then back around through Tannery Park, and then ultimately connecting to Brevard High School. And what you're beginning to do then from a policy standpoint is open up new avenues for people to walk and bike, getting bikes off of roads so they have a safer place to be, walkers as well. And all of these things really will enhance downtown Brevard. And city, and I would compliment the mayor, the manager, council, and the planning team, and they hired a consultant to actually help write the grant. Have done a wonderful job. I have read the proposal. I have seen and have written many of the support letters, or at least drafted, ghosting in the background, support letters. This is from a policy standpoint, helping the city of Brevard get this one grant would probably be one of the most significant things that we could do to help the city in its efforts to make the environment safer and more accessible for biking, walking, and pedestrians. So that piece is one part of policy that the steering committee approved. Another piece is assisting the city of Brevard with updating their land use plan. I met last week with Paul Ray, the planning director, and we talked about land use plan. And actually, I think they really want to look and focus on how can we update the comprehensive plan with new land use maps as a part of that. And so I'm working with our national consultants on the built environment, taking my own experience and helping to craft the 2025 Transylvania County Comprehensive Plan, and working now to say, okay, how do we in the next year really help the city focus on updating the comprehensive plan / land use plan as a form of policy on the built environment. The Food Nutrition Committee is working on policy that would say, how do we create a food advisory policy council here that would look at food from farming, distribution, restaurants, the college cafeteria, the schools, all the way to recycling or composting of food. And what's that cycle look like? And for me, this is almost in a way looking at economic development in a way of how do you assist these different pieces enhance and actually be able to do more in this community and hopefully engage the farmers, again, farmers, transportation, how do you move products? How do you get them to the schools? How do you get local goods, farm goods to restaurants, Brevard College, or even to the schools? And so that's a policy piece that the food nutrition group is looking at. We are exploring what policy looks like in other parts of the state. And we've got a really active group on that. The two co-chairs for that group, Alice Wellborn and Frances Bradburn, have already taken a really decisive leadership role in that. And I should point out for the built environment, Billy Parrish and Maureen Koploff are the two co-chairs there. And Maureen, I've worked with for years. She was on the county planning board when we worked on the 2025 comprehensive plan. Billy is coming in as the new president of Heart of Brevard, and his background is ideal for helping with the built environment. And then the other policy piece is working on trying to reduce the use of tobacco products and vaping. One of the things, I'm going to digress for a minute. In early November, during the election, I was the only person voting at Brevard College. There were 6 poll workers and a judge, poll judge, and the poll judge called me over and said, you know, what is this with blue zones? You're going to take away my, you're trying to get rid of meat. You're trying to get rid of French fries at restaurants. I need meat. And there was just this conversation of really disbelief that we were going to try to change and get rid of certain things. So I talked to the team here and to the national team, and I think that one of the important things about blue zones is that our efforts, and you'll see where I'm going to link this back into tobacco and to vaping, and our efforts are really to try to lift choice, and particularly with the built environment and with food, trying to make healthier choices easier. We're not saying don't eat meat. We're not saying don't eat French fries, or in my case, don't eat Yorkshire pudding, which is my probably the one food that I should not eat, but I only eat it twice a year. And I think that what we're trying to do is say on food, for example, eat more plant-based options as opposed to meat. But we're not saying don't do it. We're just trying to lift more, with the exception, and this is where I'll tie back into the policy on tobacco and vaping. That's one area where we're trying to say, maybe that's not what we should be lifting. That smoking and vaping, we know, are not good for you. That said, we understand personal choice, and that if somebody wants to smoke or wants to vape, that's their right, but we think that it should be in a place of their vehicle or in their home. And from a policy standpoint, probably not something that we would want to encourage and have out at public events. And so Beth Hyatt is the chair of the tobacco group. And we saw last November, the county, not the city of Brevard, but the county took a really significant policy step towards tobacco when they voted to not allow tobacco products on any county property, including parks and recs. And that is really focusing and saying, we know that tobacco-related products are not good for individuals. So those are the areas of policy that we're working on. I digressed and wandered a little bit there, but hopefully I answered your question.
You answered very thoroughly, and I appreciate that, Mark. And I appreciate the fact that yesterday Tammy and I spoke about live well longer, and I really connect that around to what I'm hearing you articulate in the policy, including some of those that might be a little a tougher pill for some of us to swallow than others, when it comes to things like the tobacco policy, et cetera. But the heart of it being around live well longer really is the piece of it.
Yeah,
I
and I think that, I'm sorry to interrupt, but where the blue zones communities, when Dan Buettner was asked by National Geographic to identify those areas around the world where people live longer, and they looked and found those communities where, on average, you had a much larger population as a percent of people that are living to 100 or beyond. But, but to me, probably the more important piece is not living to 100, but living that 12 to 15 years disease free or with fewer diseases that require a lot of intervention or drugs. And so to me, that's where Blue Zones project really adds value to this community, is making healthier choices easier for people, whether it be food. One of the things that Trent will be working on with grocery stores is a checkout lane at some of the grocery stores where you will not be assaulted by sugar drinks and by candy and chips, but by healthy options. So again, going through that, the easier choice then is to get a water drink or fruit or something that is healthier as a snack, nuts, as opposed to sugar. Again, with walking, I think it was probably about 3 years ago, back in February, I was walking from a meeting with the city back to my office, and I was in the walkway. I had the walk light, cars were stopped, and I still got hit by a car by somebody that just wasn't paying attention. And so trying to make our built environment safer so that people don't worry as much about being hit, so that they can make that choice of walking if they want.
Well, I so appreciate what you're doing there, and we don't want anyone else to have to face what you went through after being hit in the street. We definitely want to make that town walkable. Well, I have one final question, Mark, and then I want to respect your time and wrap things up. But we talk about the Power Nine. Tell me about your favorite Power Nine.
I love food, so healthy food options would be one. I don't know. I was asked this when onboarding and we were sitting down. There's also right tribe and being amongst people that are of like mind. I relate to that in a community like Brevard because I think so many people here share the same values, looking for health. Um, but I think natural movement is probably my favorite. I do a lot of walking. I walked into work this morning, walk home for lunch, walk back. I probably, from an exercise standpoint, go a little bit too far. I know you have a work colleague that would probably fit in that same vein of almost, it's stupid. Why are you jogging as much as you do or exercising? But natural movement is there. But those would be probably the top ones. I would have to turn the question and ask, I know this is, you're interviewing me, but what would be yours?
Well, I am drawn, first of all, to purpose, because for me, waking up and knowing purpose every day is so very, very important. And then I would say the right tribe. And I'm just very blessed with a beautiful family and some incredible friends. And so those two probably draw closest to my heart. But I certainly can appreciate a great meal. And I love to be outdoors. And my family and I, we hike somewhere, even if it's just over to our family farm almost every
Well,
week.
somehow or another, you need to change that conversation and include yours in the final version of this.
Yeah, absolutely.
Yeah.
Absolutely. Well, Mark, thank you.
Purpose, I think purpose clearly is for many people, and I think with COVID, and that's one thing we had talked about prior is, we're in that COVID environment right now, and trying to understand what purpose is and how do you communicate. with your tribe? How do you communicate with others, all being challenged right now with COVID? And in fact, a lot of our work has been challenged too as we look at ways of engagement with people and how do we do that in a way that involves as many people, but purpose clearly is.
So I appreciate all of that. And thank you so much, Mark, for taking time to be with us today on Pisgah Health Today. Like with Tammy yesterday, I could talk with you for hours, learning about and just enjoying what I see happening with the Blue Zones Project. Thank you for your leadership.
Appreciate all that you do in the community as well. So, Angela, thank you.
We also want to say thank you to Wildflower Media for their creative and technical support, as well as the Pisgah Health Foundation, to their staff, to their board of directors, as well as to the Physicians Roundtable for all of their continued support in helping our community to live well longer. Thank you, and we'll see you on the next Pisgah Health Today.
Take care.